There is outrage and there is disgust following the arrest of an emergency room nurse at UF Health accused of stealing medication.
To hear that offenses like this are happening in our hospitals, that nurses are using drugs and stealing drugs while they're at work is actually appalling.
A nurse who asked to remain anonymous first told us about the arrest of 41-year-old Desiree Leto. She was taken into custody at work earlier today. News4Jax reporter Eric Avenier joins us live from outside of UF Health Hospital near Springfield to explain why there's even more to this story as I understand it. Eric?
Yeah, when Leto was arrested earlier today here inside UF Health, she was already out of jail on bond following a July arrest in Clay County, where authorities say she stole medication from Orange Park Medical Center, where she worked in the emergency room previously. Investigators say in that Clay County case, the medication she stole was meant for patients who were in pain. When police took 41-year-old Desiree Leto into custody here at UF Health, news of why the emergency room nurse was arrested quickly began to spread among nurses at other Jacksonville hospitals. A nurse who asked to remain anonymous in this story says allegations of Leto stealing medication were hard to keep swept under the rug. How did you find out?
The medical community is actually very close. So, when something happens, we all know.
The arrest report, which details the allegations against Leto, was not available despite confirmation that she was booked into the Duval County Jail around 1:30 Friday afternoon. But News4Jax did a simple Google search and learned that Leto was arrested back in late July on 2 counts of obtaining medication by fraud while working as an ER nurse at Orange Park Medical Center. On Tuesday, she was arraigned in that case and pled not guilty, so the case is going to trial. According to the arrest warrant affidavit in that Clay County case, Leto had been under investigation since March. A hospital pharmacy director told the detective there were multiple suspicious medication transactions from an automated machine that dispenses pills. The pharmacy director also told the detective there were medications that were not scanned as being administered to patients, as well as no documentation as to why the pills were removed. But investigators say there was surveillance video that pointed to Leto as a suspect. The warrant affidavit also states that when hospital managers questioned Leto and ordered her to take a drug test by way of a urine sample, one of the nurses who witnessed the test told the pharmacy director she believed Leto faked the urine sample by having a Foley bag strapped or stuck to her body. And according to the warrant affidavit, the urine sample was not a normal color. Given this public information about the Clay County case is readily available for anyone to read, the question now is, how was Leto able to work at UF Health as a nurse while her Clay County case is still open?
That is even scarier, that this information is out there and these people are still being hired to work at the bedside.
UF Health issued a written statement that says the individual in question is no longer employed by UF Health Jacksonville. Because this is an ongoing investigation, we ask that you contact the Jacksonville Sheriff's Office for more information. In the meantime, when we looked up Leto's nursing license, we found that despite the fact that she had been arrested now twice on charges involving the theft of medication, the status of her nursing license is still clear and active with no discipline cases. Now, Leto makes her first appearance in this Jacksonville case, and she makes her first appearance in court in the Jacksonville case tomorrow morning around 9 a.m. Pre-trial for the Clay County case is scheduled for next month. Reporting live outside UF Health, Eric Avenier, Channel 4, the local station.
Eric, do you know if UF Health did a background check or possibly called Orange Park Medical Center to inquire about her employment there?
Tarek, that's a really interesting question. And right now, we cannot confirm if that was done. And I will tell you that a source within UF Health says that the hospital is dealing with a significant shortage on nurses and that they typically check to make sure a nurse that they're going to hire at least has a license that is still active and is in good standings.
Which she did. All right, Eric Avenier reporting to us live. Thank you.